Welcome back to the Rethink It Brain Health and Longevity podcast. This podcast is for those of you who are currently struggling with brain health issues and for those who are looking to protect their brains in the future. So this is really important. In this podcast, I encourage you guys to learn to be a good steward of your health. A steward is someone who cares for something that doesn't belong to them, but to someone else. I believe that the body is a gift from a loving God, and we are granted the opportunity to care for it as an act of worship every day of our life. I believe that our health is a gift as much as any other resources that we are granted in this life. And most people, try not to be frivolous with their monetary resources, right? Certainly not with their time resources and not their relationship resources. I believe that our health is one of those precious resources that we are called to intentionally care for during our time on earth. In this podcast, I hope to give you practical, scientific, and cost-effective tools to empower you toward good health stewardship. Dementia rates are skyrocketing at younger and younger ages, and my hope is that you are able to use this information in this podcast to prevent dementia or even reverse course. I believe the body is created with the innate intelligence given by our Creator. Because of this, it is possible to heal from the most difficult health challenges when we address the root cause. When you learn to use the right tools to care for your body, you can be your own best doctor. There is hope for lasting healing. Welcome back to the Rethink It podcast, all you beloved, curious, health-minded thinkers out there. I want you guys to know that I began researching for this podcast in December, and it has taken me this long to get it all put together in a way that is both honest and complete without being a dry scientific overview. So I hope this content does bless you as we talk about, say, the latest weight loss craze, which is Ozempic. And I am sorry that you guys had a 2-month delay without any information from me. I have been working on this podcast and another one that I think is going to be so important and special, and I hope you get a little bit more of my heart in that one. And we will be talking on that podcast about how Christians should view holistic health. So look forward to that one. But for this one, we're really going to go into Ozempic and all the hype around it, and is it good, is it bad? I'm going to give you both perspectives because I do see this in my anesthesia practice a lot, and it does have an impact on how we practice. And I want you guys to really understand the impact these have on your body, and maybe some other tools that you can use to in lieu of Monjaro or Ozempic that may be a bit better for you. Okay. So being that this podcast was meant to be for the new year, I was hoping that this would be a time where you would be thinking forefront, like weight loss, new year, new you. You're probably getting all it in January. Probably we're getting all the new year, new you, promotions from the gyms and from, detox programs and name it, like everybody does a new year, new you, right? And I suspect there was probably an uptick in prescriptions for Ozempic and Monjaro during that time as well. But are these medications really good for you? I'm going to let you guys take a look at some of these ads that these companies put out.
Looking to get back in your type 2 diabetes zone? Once weekly Ozempic can help.
I would say perspective on this subject really matters. So most medical providers who work in primary care will say that these medications are a godsend. They see the numbers of obesity rising each year, and with it, hypertension, diabetes, heart disease, stroke, decline in mortality, meaning earlier death. And so much more. With diabetes comes amputations and gangrene and eye loss and vision loss and hearing loss, just all the things. So it's certainly in a primary care practice, something that would fix what they consider the root cause of those things, which is obesity. That would be a miracle, right? So any drug that reduces the number of obese patients will be met in that circumstance, in that perspective, with a resounding applause, and it would be considered a modern miracle. But is it really a miracle, or is it a scam? As you know, we like to challenge you everyone to think through the information out there and not just simply accept it and move on. And I would also say that the louder you hear a narrative being promoted, the more you need to think about it critically. So when you have the right information in the context that to think through it properly, you can apply your amazingly beautiful mind to it and empower yourself toward good, lasting, and thriving brain health, right? So is Ozempic a miracle or a scam? Let's talk about it. I mean, the entire town of Hollywood is on it, right? I mean, fashion icon Kim Kardashian, even Elon Musk, even Oprah. I mean, they're all drinking the Kool-Aid of Ozempic. Since the rich and powerful are using it, must be okay, right? I mean, I'll share my opinion on that later, but for now, let's look at the story of Ozempic, the science, the physiology, and I promise I won't get too boring on that, and what we do and what we don't know about it. And there's a lot we don't. Okay. Ozempic was released by a company called Novo Nordisk in 2017 with the FDA approved indication for type 2 diabetes. That is diabetes that is a truly modern diabetes, not the kind caused by reactive inflammation after an infection and autoimmune destruction of your pancreas, which is type 1 diabetes, often found in children. This is the type of diabetes that is caused by what we'd like to say is overeating, but I would say it is eating the wrong foods for a long time. Because a lot of type 2 diabetics just don't eat a ton, but they sure do eat a bunch of the bad stuff, right? So in 2017, Ozempic was released for diabetes, and the side effect from that was weight loss. And word spread that these drugs were so much so that these drugs were beginning to be used off-label and prescribed off-label. And I remember seeing in I feel like in 2020, especially 2021, that we had run out of Ozempic due to the off-label prescribing of these drugs to so many people. The demand became so high that a drug shortage affected the diabetic population because they couldn't get hands on it, and those were the ones it was prescribed for. So as a result of that, Novo Nordisk quickly realized that they were standing on a gold mine. It was definitely an accidental stumbling into a gold mine, but they definitely knew what they had. And unfortunately for them, they had this pesky problem with the whole FDA regulation, how we get approved drugs and get drugs approved and such, right? It takes a while. So to get a drug to market, it has to be tested for that specific indication and shown to be effective for that specific issue. And in this case, Ozempic had been tested well for lowering glucose levels in diabetes, which we can obviously make an assumption that this is going to help with weight loss, right? Just stabilizing glucose is going to help, surely. However, they still had to test it specifically to prove that there was a statistically evident relationship with the drug and obesity. Any other use, if it hadn't been approved by FDA this way, was considered off-label, and off-label is not covered by most insurance. So we're talking about a cost of $1,500 to $2,000 a month. Of course, that limits the market, and it definitely limits the company's profit if the insurances aren't approving and paying for these drugs. Less people can afford to do that out of pocket, right? So the company solution was to formulate a more potent, let me emphasize, more potent version of this, which was called Wegovy. So you may have heard Ozempic, but maybe you don't, maybe haven't noticed Wegovy, but I sure have seen it a good bit. So Ozempic's usual dose was roughly around 0.2 milligrams per dose to up to 2 milligrams per dose, but typically on average it was less than a milligram per dose. The average dose is around 0.5 to 1 milligram per dose. So it's injected subcutaneously, meaning under the skin. Whereas Wegovy, the average dose is 2.4 milligrams. So it doesn't seem like a huge dose, but it is a big difference. That's 100% higher, 150% almost. So there's a big difference between Ozempic and Wegovy. Wegovy was quickly approved by the FDA in 2021, which is kind of impressive and very quick push through. And that opened the door for insurance coverage for obesity indicated prescribing. If you follow the trend, you likely noticed a major uptick in advertising in July and August of 2021 by Novo Nordisk for both Ozempic and Wegovy. The company spent over $11 million promoting this drug to both consumers and prescribers, which, by the way, is illegal in most countries. I'm pretty sure it's illegal in 95% of the countries out there, except for the US. It's kind of weird. It is a weird thing that we... Anyway, that's much my opinion. How does this work? So how does Ozempic work to help us lose weight? Let's talk about it. When you finish eating, your body releases a hormone called glucagon-like peptide. You've probably heard GLP agonists by now a million times, maybe not, but that's what Ozempic, Monjaro, and Wegovy are. And interestingly, a few of the other diabetic medications indirectly affect this glucagon-like peptide. Okay. And that glucagon-like peptide sends signals to your body that you are full. Ozempic and Monjaro and Wegovy are drugs that mimic this action. So they are like an artificial hormone. The artificial hormone, GLP-1, when injected, makes you feel completely full, even if you haven't eaten all day. This is a truly revolutionary approach to weight loss compared to the forerunner weight loss drugs like phentermine or topiramate or Xenical. And I really want to talk about these for a few minutes just to give you an overview on these drugs. They were all very, very different and all had their own unique risk factors. So phentermine was something we call a sympathomimetic. Another sympathomimetic drug out there is cocaine. So it basically drives if you've been following at all in any of the holistic circles in any way, you hear that we need to improve the parasympathetic system. We need to bring us out of this fight or flight system and into a rest and digest and a calming system. So we have the sympathetic system that is our fight or flight, and we have the parasympathetic, which is our rest and digest. And this drug, phentermine, tends to promote that fight or flight response. It's the autonomic, or I like to say automatic nervous system response to be in fight or flight. So as you can imagine, some of the side effects include anxiety because you're heightened and you're hyper and you're ready, you're hyper vigilant. So of course, this also leads to things like anorexia. So phentermine was the benefit of being a sympathomimetic. If you know anybody who's been addicted to cocaine, they are also really skinny, setting them in fight or flight. They're always on, and they are not hungry, and they're all revved up, so they're burning through some calories, and of course that leads to some weight loss. But it also leads to elevated blood pressure, elevated heart rate, insomnia, anxiety, and a whole lot more. This drug essentially does the opposite of what we try to do in holistic health plans. But one of the first things your functional practitioner is likely to do is to assess how high of a fight or flight response you have and try to get you back into balance. If they're any good, that's what they will do. So this drug does the exact opposite, and I don't encourage anybody to take phentermine. So let's move to Topamax or topiramate. Topiramate is a drug in a category of anticonvulsant drugs. So these were the drugs you'd use for seizures, or we call them seizure meds, right? It affects the nervous system by increasing the calming neurotransmitter called GABA. So far seems good, right? Not doing the sympathetic mimetic thing, right? But it also blocks an enzyme called carbonic anhydrase, and this affects the side effect of this drug is by blocking that carbonic anhydrase. So you want to do that in certain circumstances. You don't want to do this all the time. So the side effects of that, which is really has an impact on the brain, is linked to dizziness, anxiety, confusion, brain fog, and memory issues. So you do not want to block that enzyme for very long if you love your brain. You can imagine it is an anti-seizure drug, so long-term use is not ideal. Xenical was another drug that came out as a pre-runner to these GLP-1 drugs, the Ozempics. And this drug worked completely different than the other two mentioned by blocking stomach and pancreatic enzymes called lipases. Now, if you listen to me talk at all, you know how much I love my enzymes and encourage people to have foods rich in enzymes. And you need your enzymes. They are so important to breaking down getting the amino acids out of your food. Lipases, you need all the great amino acids from your fats. So if you're blocking that enzyme, you're just moving undigested fat through your digestive system. So it leads to poor breakdown of your fats and your triglycerides. And this can lead to a whole host of nutrient absorption issues like A, D, E, and K, which are all your fat-soluble vitamins. They will not be absorbed if you are taking Xenical. In fact, it's been well studied. So needless to say, this drug can lead to significant issues and not so minor issues like severe liver injury has been reported, increased kidney stone formation, not surprising, has been reported, malabsorption syndrome, where you're just dumping all your fat and every time you eat, you literally just go. Gallbladder issues, all those have been related to Xenical. There was a non-prescription version of Xenical that I think is even still available on Amazon called Ali. I do not encourage people to take those drugs at all. So in walk GLP-1 agonists. I've probably already mentioned GLP-1s, Wegovy, Ozempic, Monjaro. They trick your body into believing it's full, even if you haven't eaten all day. But how does it do that? So here's what we know. GLP-1 receptors exist in the brain. They exist in the hippocampus, which is our short-term memory area of our brain. So this may be good or bad. Is this good that we're giving a synthetic hormone that affects our hippocampus or memory area? This causes the brain to communicate to the body that you are full, and it makes even the thought of eating highly undesirable. So you literally do not want to eat. What we don't know is that there might be an apparent effect on the autonomic nervous system, like we were talking about. I want to say automatic every time because it's so easy to remember that's working automatically in the background as like your CPU system, right? So it affects the autonomic nervous system by increasing sympathetic tone, which is very similar to what we talked about with topiramate, phentermine, sorry. So increasing sympathetic tone means we're increasing our fight or flight, and they don't exactly know how it's doing it. So that's kind of a big deal. GLP-1 receptors also exist in the gut. This is what most people already do know. So activating these receptors helps your body release something called insulin, metabolize glucose, and slow the digestion of food. We'll come back to the slowing of digestion of food in a minute. GLP-1 receptors, they act on the pancreas. They cause an increased release of insulin from the pancreas. Not bad so far, right? These receptors, GLP-1 receptors, are found in the liver and in the lungs. In the liver, it actually improves something called surfactant, which causes a reduction in mucus inflammation. So that's a good thing. In the liver, it causes the liver to release less of the stored glucose by affecting the glucagon receptors. So these drugs basically improve fatty liver because most of the fatty liver today is caused by elevated glucose from sugary diets. All right, in the heart, GLP-1 seems to have a benefit on the cardiovascular system for the same reason that we talked about with the liver. It lowers inflammation from a high sugar diet. It does lead to higher heart rate. And again, I think they don't really know why, but it may have something to do with related to the autonomic nervous system being stimulated. But again, we don't know why it's doing that. So there is an elevation that happens in heart rate and in blood pressure. And it's typically, the blood pressure elevation is typically increased for a short period of time initially and then lowers over time as the weight comes down. So, but there is this transient elevation in blood pressure, but the heart rate doesn't seem to go down. Okay, so that's something that's interesting. The kidneys, there is some diuretic effects on the kidneys. So meaning it makes your kidneys process your blood better so that you make more urine. But we don't know the long-term effects of that. So one thing we do know is that this drug is being pushed as a magic pill that will make you thinner and more beautiful overnight without much discomfort on your part. Does it work? Yes. It is a profound appetite suppressant. Is a profound appetite suppressant, and it works. Some of the side effects, however, may be less desirable. And as one thing I do know from having had breast implant illness, having had psoriasis and other things, and the drugs I've been on in my own life, is that we are not told all the side effects. We are not really fully given an informed consent. And I mean, this has something to do with both of us, right? The doctor doesn't have time to give you all the list of the medications. We don't always think to look up all the side effects of the medications. I'm sorry, the doctor doesn't have time to give you all the side effects of the medication. And quite frankly, sometimes we want what we want and we don't care what the side effects are, right? So some of us are guilty of that. Certainly that's the case for me with breast implant illness. I wanted that. I didn't care, really. I didn't think that there was an issue. Maybe a little red flag in the back of my mind went, but I wanted an implant, so that's all there was to it. You know, there's nothing really wrong, so to speak, about that, but the reality is there are side effects. And so I'm going to give you some of those side effects so that you know, if you care to know about this. This is important. So, of course, if we're slowing digestion, you can imagine that we do get some digestive irregularities like nausea, vomiting, constipation. This is a big deal and very, 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 very common in Ozempic. 1 out of 4, that's 25% of these people who take Ozempic or one of the GLPs, will develop nausea, slowed digestion to the point of gastroparesis, meaning almost complete stoppage of your gut. What's interesting is that diabetes, one of the reasons we really hate diabetes in healthcare is because it damages the nervous system so significantly, the peripheral nervous system. That's why diabetics injure their feet, don't feel it, and get ulcers, and then have to lose their toes or their feet and things like that because of this peripheral damage to the nervous system. Well, similarly, in diabetes, we also get damage to the nerves that control the digestive system. So in diabetes, we actually get gastroparesis if it's pretty advanced. So it's interesting to me, just of note, that a drug that is designed to treat diabetes, type 2 diabetes, and prevent the side effects of it, has a side effect similar to the disease itself. So just a thought here, just my little aside. But another side effect that's listed and well known is ischemia of the small intestine. So that means you lose blood flow to the small intestine, which can lead to loss of part of your bowel. Malnutrition is a big deal with Ozempic. We'll talk about that a little bit more. That leads to loss of muscle mass, infertility, hair loss, anxiety, depression, hot flashes. Muscle mass is lost at a greater rate than fat is lost. It's like 2 times the muscle is lost per pound of weight. So something to consider. Kidney failure is a kidney disease, and failure is something that is linked to this. Gallbladder issues, intestinal blockage from the gastroparesis, pancreatitis is mentioned. And you know, one thing that you might want to know about gastroparesis that's really interesting and has actually been reported in the result in the literature and even in the common layperson journals when they talk about this, is that the gastroparesis can be so significant that the food just sits there and ferments. It rots in your stomach, which leads to halitosis, something maybe you wouldn't talk about. Maybe it's just not something that you would necessarily think is that important, but when it's you having bad breath, it's a big deal, right? And then the other thing that's important is that there is a black box warning for Ozempic about thyroid cancer. So there is a link between it and anybody who's had any history, even of a benign thyroid tumor, should not be using Ozempic. It's actually a warning from the FDA. So what we do know also is that there is an increasing report of depression, suicidal ideations, and psychological conditions being reported every single day with this drug. We also know that 33 people have died from paralysis of the intestine, that gastroparesis that we talked about. When your intestine gets paralyzed, it's called an ileus. And when that stops, when movement stops, everything backs up, the pressure builds, and you can rupture your colon. And as of November 2023, 51 deaths have directly been linked to Ozempic. And 40 other ones have been linked to Wegovy. And there has been over 15,000% increase. 1,500, sorry. I said 50,000. 1,500%. So 1,500% increase in calls to poison control centers related to this drug. This is crazy town. So this is stuff that might not be mentioned in the news. This is stuff that's kind of, hidden in the background that you might want to know about. Now, this does not include numbers of those who have experienced with the ileus and stuff like that. This doesn't include the number of people who have experienced like persistent gastrointestinal issues, stomach paralysis, and the like from this drug. What I can say, that is a well-known fact, is that gastroparesis, the severe slowing of digestion, is linked to this category of drugs significantly. It is enough that your anesthesiologist will likely cancel your surgery if you have not stopped this drug in over 7 days. So if you took your Ozempic or your Wegovy, your Monjaro on Sunday and your surgery is on Friday, we are probably not going to do your surgery because we see that much of the food retained in your stomach that it can be a risk for you to aspirate that content during anesthesia induction. So that's not good. We don't want that. So what is concerning to me is that even when we use precautions in surgery, like holding the medication 7 days before surgery, I routinely see a ton, and this is gross warning here, but I see a large volume of undissolved, undigested food in the stomach when I go to remove your stomach contents while you're asleep. That's a big deal. So just keep that in mind if Ozempic is something you're thinking about. Another issue with it is Ozempic rebound. So let's talk about that. That is the weight gain you regain after you stop Ozempic. This gain is often greater than your weight loss. So you lost 100 pounds and you gain 125 back. You lose 50, you gain 60 back. That's not cool. Why does this happen? Well, when you give your body a foreign hormone, the body signals to the brain to slow down the production of the natural hormone. That makes sense to everybody, right? So now, after you've stopped Ozempic, you don't just go back to baseline. Now you have an almost insatiable hunger. Now you have all these extra receptors in your brain waiting for a GLP that's not coming, right? And your body has dialed down its production. So you have more receptors and you have less of the naturally occurring hormone. So you are now starving when you stop this drug. So another reason for the rebound, though, is not just the physiologic changes, but there's also a problem with the way you lose weight on Ozempic. The amount of lean mass that is lost while taking this medications is far greater than that of the fat loss. Studies are showing that you lose nearly 2 pounds of muscle with each pound of fat, meaning you become a skinny fat, not a cut lean fat. And of course, we know that lean muscle is what contributes to your overall metabolism, your resting metabolism, and how many calories your body will burn at rest. So if we lose a ton of muscle mass, you're going to lose a healthy metabolism. So according to a study in 2022, 2/3 of people who lost weight when they stopped taking this medication gained it back plus some. This means that, let's talk about, we asked at the beginning, is this a miracle drug or a scam? Maybe I should define what a scam is. We'll go back to that in a minute. But the problem with this model of you not being able to stop this drug, it can't be used like for a year and then you stop it and hope to continue your weight loss journey. The problem is that you have now become a customer for life if you like your weight loss, if you want to maintain it. And another thing to consider is that currently most insurance appear to cover the $1,600 cost of these drugs for obesity. But with the increasing cost of healthcare in America, it's just a matter of time before that may change, which leaves the hefty bill of $1,600 for the drug to continue in the lap of the customer. And in some cases, this is already the case. So when the inevitable happens, life finances get tight, the patient is left with almost guaranteed weight rebound if they can't afford the drug. That's a thing, that's a problem, right? So creating a customer for life is a real consideration. Is this something that Ozempic and Monjaro, is this something that Novo Nordisk was considering? Maybe this is one of the reasons that the stock prices skyrocketed for these drugs literally the day after they got approved for weight loss. So no one faults business for trying to be a profitable business. This is what the pharmaceutical industry is. After all, it is a business. But the concerns I have for this business model is that it is hard to flesh out the real story. Let's be honest. We all know that pharmaceutical companies fund studies. And if you don't know that, here's your card. Pharmaceutical study companies fund studies. And if they haven't funded the study, it's likely not a study that's going to be well known or promoted. There's only some 24 hours in a day, and doctors would love to be able to keep up with all the studies, but I guarantee you that we have a hard time doing so, especially when the studies are not forefront and center, right? If they're kind of in the background because they haven't gotten the marketing promotion that these drug companies have to promote their new updated studies, that we're not going to dig those out. There's going to be it's hard unless you're in some university that is a educational university and you're not working in a clinic, which does us no good, right? So that's the reality of the medical system that we are in. It is a broken system. It's not perfect. We do the best we can in it, right? I remember this was something that was pretty shocking to me when the fact that they fund studies. When I sat in grand rounds as a little baby PA student, now they may not have outright altered the data. They may not always outright alter data, but there are ways to present positive results and omit negative ones. And we talked about that a little bit in the Medicating Normal series when we talked about how they approved Xanax and how they showed that they only published the first six weeks of data because in the first 6 weeks we saw significant improvements in anxiety, but at 8 weeks it was worse than baseline, right? So we can omit information, shortening the window of reviewed outcomes, like we said. Disqualified subjects halfway through a study. There's a lot of ways to alter the data that seems ethical, but is just a way to alter the data. I'll be honest, the Ozempic craze highlights a lot of the issues in American healthcare. Firstly, why is obesity such a problem? What is wrong with our food and what they allow in it that causes people to gain weight despite efforts to lose it? What do the rest of the countries do that we don't, that gives them a lower rate of obesity? I mean, in the Western European Union, rates of obesity are 13%. Ours are 43%. Is the problem our economics? Is it political? Is it because our democracy creates a system that allows those with the most money to buy politicians to create laws that govern healthcare industry, food industry, and pharmaceutical industry? Let's be honest. Is that the situation? Could there be an issue with the fact that the same government agency regulates both our drugs and our food, i.e. the FDA? I mean, if the food we eat makes us sick so that we need more drugs, well, that's a problem. Shouldn't those agencies be a separate agency and transparent? I mean, I don't know. Maybe that's an issue. Maybe the problem is cultural. Maybe we are so used to convenience that we forget to invest in the most important non-financial asset we have, which is our health. Investing in our health means changing our food choices, our lifestyle choices in a way that is counter-cultural and super uncomfortable. And I will testify to that. It is not easy to travel when you try to eat clean and you try to be an advocate of your health and you take supplements that you can't just pick up at the drugstore. It's not convenient. It's countercultural. Do we willfully want to stick our head in the sand? and ignore the obvious situation going on around us, but the fact that our food, our air, our water are increasingly more and more toxic. I mean, as inflation continues to climb, the cost of drugs continue to climb, and monopolies like CVS HealthCore and United Healthcare in the healthcare industry are continuing to form. So this is a thing that I would encourage you guys to pay attention to. You can expect with these semi-monopolies that are forming, these big agencies that control, they are now controlling not just your doctor. They own your doctor, they own your pharmacy, they own hospitals, and their insurance agencies. These companies they were designed in order to lower the cost of our healthcare, but in fact, they have increased it. And so we can expect that cost to be continuing to go up, transferred away from the insurance companies. If an insurance company owns the hospital, they don't want to pay for things. It's going to be transferred to the patient. If the healthcare system of other countries is foreshadowing our future, then we can soon expect to have to pay out of pocket. In the UK, the average wait time for surgery is 18 months, unless you pay cash out of pocket, of course. So the same is true in Canada. The average citizen of the UK knows that they will pay cash if they want personalized healthcare. And government healthcare means a wait time. Anybody who has been in the military and been a TRICARE baby or a spouse or husband or soldier knows that it takes some time. It takes a lot more time. It is very inconvenient to try to schedule an appointment with your physician in the military. And if that's an indication, you can imagine what it's going to be like as we move toward that same model. To me, the only logical thing that we can do is change our mindset about the cost of quality healthcare. You know, in allopathic or the traditional insurance-based model, we are using a type of healthcare often coined sick care. And this is where Ozempic falls. It's a sick care thing. You've got obesity. We're going to give you this drug. Is it fixing the root cause? It is not fixing the root cause. Obesity is the problem. The drug is giving us a Band-Aid. It is going to help you lose weight, but there is a trade-off, and we listed some of those, and those are significant. So oftentimes in that sick care model, we deal with problems too late and only use a Band-Aid like Ozempic. And we give that Band-Aid for life. Just kind of imagine you're bleeding and you're adding a Band-Aid, and then you bleed through the Band-Aid, so you put another Band-Aid on. And you bleed through that, so you put a Coban wrap around that Band-Aid, just kind of put a little pressure, and the cut is really deep, but we're just going to Band-Aid it. Okay, well, over time, if the cut's deep enough, and you're just trying to use a Band-Aid, you're either going to get infection or you're going to bleed out, right? So Band-Aids aren't meant for every type of cut, right? And that's the thing. Medications aren't meant to be a long-term fix of our issue. Long-term, we need to put steri strips, we need a suture, we maybe need to do skin glue, maybe we actually need to undermine the tissue and clean it up, right? I'm going with the Band-Aid analogy. I hope you're following me here. Think about the crisis that occurred when the cost of insulin, so this sick care model, when the cost of insulin jumped through the roof, patients did not have a choice. They needed those medications. Now, insulin's life-changing. It's probably not the best choice to use because I don't really know how to reverse type 1 diabetes without insulin. However, the problem is still the same. My point is, if you have a drug that is bandaging your disease, you need it. Now, insulin, again, like I said, it's not a great choice, but you're going to do whatever you need to get that medication to stay alive or to maintain your quality of health, because that Band-Aid is something you need. So people were paying cash, mortgaging their homes, and doing whatever it cost them to get insulin. And that, if we have a population addicted to medications, all types of medications that are maintaining their quality of life, and all of a sudden that cost triples or is transferred to you, what are you going to do? The alternative approach is the root cause holistic healthcare approach. So the cost of investing in this type of care may seem steep, since we might not be in a crisis level in our health. So this is the problem. Sick care, you have a symptom and it is bothering you. and you are going to seek out help to get that symptom corrected at any cost, right? You're going to take any medication, just you got to get your blood pressure under control, the headaches, the ulcers, the skin rashes, right? Those type of things. Holistic health, typically your symptoms are a little bit more benign, or maybe they are less obvious, or maybe you've been told you're fine, everything's fine, your lab work is fine. But you're not typically in a crisis. You haven't had a heart attack yet. Typically, if you're seeking holistic health, you're seeking to truly prevent disease. So the difference is that instead of band-aiding for life, we are trying to reverse course at identifying a root cause, ultimately saving you thousands of dollars in the end. Either way, we will have to pay to preserve our most important asset, our health. Ozempic is just another drug in a long list of band-aids that we use in healthcare. And it should be that we address the root cause of our obesity, right? Not continuing to band-aid with Ozempic. I expect it to prove damaging long-term, especially since we don't know the long-term impacts. It affects the hippocampus. It stimulates our fight or flight system. We don't know what long-term effects it will have on the kidney. We already know that it's linked to thyroid cancer and psychiatric illnesses. So we have only had this drug on the market for a very short period of time, and we already know those things. Don't get me wrong. With all this said, I am not anti-pharmaceutical. Modern medicine has an important role to play in acute care, and it is life-saving care. But they should not be the solution we consider for chronic health issues. They were never designed that way. These drugs are synthetic. Synthetics are not compatible with biological tissue. So those issues will come. Those drugs will come with issues. Think about it. What are we doing when we detox? That's a buzzword, right? Everybody hears, I need to do a detox, especially in the beginning of the year. Let's do a detox. Everybody's doing a detox. But what exactly are you detoxing? We are trying to eliminate stored synthetics in our body. Synthetics like plastics and petrochemicals, like pharmaceuticals and pesticides. So if removing those things is healthy for our body, why would we think that adding them in for the rest of our life in the form of prescription medication is not going to cause issues? I want to point you back to that Medicating Normal podcast. I hope you guys go back and listen to it. It was so good. But my guest mentioned the fact that we have the wrong idea in medicine. She actually quoted a physician in the UK, and I can't remember her name right now, but she said that we need to go away from this idea of prescription versus drug model, meaning that all drugs are drugs. All prescriptions are drugs, right? So good or bad, cocaine or what was it, phentermine, they both are sympathomimetic. They're both drugs. Just because they're socially accepted in one category because a doctor has prescribed it does not mean that it is safer than cocaine. Does that make sense? I don't know. It's a really important mindset to take here, when it comes to taking prescriptions and thinking of taking a prescription, especially for something, especially if you are the person who just has some nagging 20 pounds to lose. So what's really our takeaway from this topic? Let's talk about that for a second. Ozempic does have a role to play. After all that I've just said, I am saying that Ozempic does have a role to play. And I honestly think that it may serve as an amazing life-saving tool in a difficult lung issue or a short-term help in liver disease. But I would argue that there are more effective natural solutions. There always are. For type 2 diabetes and for weight loss than taking a drug with these risk factors. Several years ago, I lowered my husband's hemoglobin A1C, which is a marker of your average sugar for 3 months. Okay, you want that around 5, 5.5 to 5.2-ish. My husband's hemoglobin A1C started at 6.9. That was very high. That is not a good number. I lowered it using a combination of powerful herbs and dietary modifications. And I routinely see results like this in my clients. So it is possible to manage type 2 diabetes naturally. Supplements might need to be taken for maybe a year or more, but not for a lifetime. When it comes to weight loss, I want to address two types of people. For the person who is truly obese, struggling with health issues related to their obesity, maybe you consider Ozempic for a short period of time. And I would prefer, you know, the Ozempic form, not the Wegovy, not the super high dose form, right? Consider it for a short period of time, while also working with your local fitness professional to increase your muscle mass. Take some, investment in this. If you're going to take this drug, recognize what it's doing. You're going to lose muscle mass if you don't target it. So work with your local, fitness professional. Increase your muscle mass. Be intentional. And the goal would be max 3 to 6 months, right? 3 to 6 months. And while you're doing that, you are serious about changing your lifestyle. Maybe you're working on diet. Maybe you're paying attention to labels. Maybe you are more conscientious of the plugins in the room, that in your office, maybe in your bedroom, maybe in your home. Maybe you start to pay attention to these synthetic things that are everywhere in your life, and you cut out all these sugars. You start really being intentional while you take Ozempic. If that's you, that approach is not a wrong way to use Ozempic. Work with your doctor, work with a holistic practitioner to get to the root cause to help the weight come off and stay off. This is really important. This is how modern medicine should be used for a short time to get you out of crisis mode. Working with both types of practitioners, maybe your MD and a holistic practitioner, will help you protect your gut from the unwanted side effects of that, digestive slowing, the gastroparesis that we talked about. So to the person who just wants the stubborn 10 to 20 pounds off, I encourage you to love your body and to listen to it. Accept the season of life you are in. I'm talking to you mid-30s to early mid-40s ladies. Your body changes after you've had children. It's okay. It's a beautiful testimony to who you are and what you've done with your life. Don't hate your body. I'm saying this to myself as much as I am to you, so don't worry. Recognize that you have nothing to prove to anyone, and those who judge you by your pant size are not the type of people you want to surround yourself with anyway. The people in your life that matter, the ones that love you, don't love you contingent on your weight. Changing your mindset around the way you view your body is probably the hardest work you will ever do, but I encourage you to do it. Accepting your body in a slightly bigger form doesn't mean you don't work on it. Those stubborn 10 to 20 pounds are likely a hormone imbalance or maybe some toxic load issue that's being revealed during menopause. That does happen. That's when you really see some liver stress. So invest in figuring out what it is and working toward a solution. It might be shocking to you to know that working out harder isn't always the best solution for weight loss. In fact, if you're over 40, working out harder might actually be counterproductive. So all that to say, is Ozempic worth it? It just depends. It's not the drug of choice that I would choose for any long-term anything. I think I've said enough about how I view our pharmaceutical model, our sick care model. And I know it seemed like I went on a tangent there with, talking about the healthcare system, talking about the cultural system, but it's something to think about, especially in a, uptick in a new drug that's really making its rounds and everybody thinks that they maybe should take that drug. It's definitely something to consider. If you are looking to try to find more natural approaches, there are quite a few things that you can do. So one of the biggest things lifestyle-wise that I'm going to recommend you guys do in this area, if you're over 40, if you're perimenopause, I'm going to actually encourage you to stop doing HIIT. Stop doing those high impact, intense workouts. I know you're going to hear health fitness professionals maybe say, oh, you'll burn calories for an hour after workout or 2 hours or 3 hours or whatever it is after HIIT. When you're going through the changes, the hormonal changes, or the unveiling of hormonal imbalances that occur during your menopausal period, you are going to have a higher sympathetic drive. And what happens there is cortisol starts to go up. So every time you do a HIIT program, you actually increase your cortisol levels. You make the stress response higher. What do I want you to do instead of HIIT? I want you to maybe consider walking. I want you to move your body. I don't want you to not exercise and just ignore. I want you to listen to it. If you're one of those people who get up and work out before work and get up, go to work early, and you're working out at 5:30, if your body says no, then it's not wrong to stay in bed. I'm giving you permission, because your body will tell you, you will feel that utter fatigue, that complete exhaustion, and you need to just listen. So if you're over 40, do a little more gentle exercise. I think this is a great time for your weight training to, be something that you do. You do want to do weight training because that's going to keep your lean muscle mass up. You want to consider, if you've never done weight training, you've just been a runner your whole life, you need to introduce that in your 40s. So 30s, late 30s, early 40s. Definitely weight training, reduce those high intensity workouts. Do the things that you enjoy, because if you love what you do, if you love HIIT, if you really love it, then the balance between the serotonins, the hormone levels that come from just the joy of being there, can actually reduce your cortisol levels. That's one thing. There's a little caveat there, but I actually tell people, especially if they're chronic disease and if they're holding on to that stubborn weight, I actually tell you just to walk. Just walk every day, 30 days and 30 minutes a day. And if you can, if your schedule allows you to do it, if you can walk even 5 to 10 minutes after a meal. So you've eaten, 5 to 10 minute brisk walk, not killing yourself, not sweating terribly, but just walk after a meal. You actually cause you drive down your glucose spikes, and that will actually cause more stability in your sugar, which means you gain less, you lose weight. You hold on to weight less and you lose it. And that's huge. So 5 to 10 minute walk, brisk walk after each meal is simple. Literally, if you do that 3 times a day, you're done your 30 minutes. But I do encourage people to walk. Now let's talk about supplements, because I know everybody always asks me, like, is there a supplement that works? What supplements do you recommend? So it does depend a little on your gut biome. This is so helpful. If you actually can work with somebody to get a gut workup where they do look at the peptides in your gut and your bacterial peptides, if they get really good assessment of your gut microbiome of your gut, and enzyme production and things like that, you will have a great starting point to strategically introduce certain bacteria into your gut. But if you don't have that opportunity, if you're not on a probiotic, get on one. Okay, definitely get on a probiotic. If you're not on an enzyme, get on one. Those are just your basic foundational supplements. It reduces bloating in most people. It will improve motility. It will improve food breakdown. It will improve all the things. Nutritional uptake, which means you're going to feel better. All the things that will help you with weight loss. So if you're not on any probiotic, start on a probiotic, start on an enzyme. If you want more specific strains, I encourage you to look for Akkermansia. It's incredible. It actually stimulates GLP-1, but does it naturally. So Akkermansia is an expensive strain of probiotic, but it's found in a lot of good probiotics. So this is a good strain to work with. And there's certain forms of Clostridium as well. Yes, Clostridium can be bad in the gut, but we have multiple different species of Clostridium. And there are certain ones that actually help stimulate insulin naturally, not as a drug. So it naturally does it by, working with the liver and the pancreas. Okay. And also certain bacteria in your gut will literally stimulate the production of butyrate. This is so important. Butyrate is like huge. So if you want to increase your butyrate levels, this is going to help increase the growth of good bacteria. And if you take the right bacteria, you'll increase butyrate production. So if you're in a bad place, completely terrible place, I would encourage you to take a probiotic, an enzyme, ideally a probiotic that has Akkermansia in it. And if you feel like you have a lot of allergic reactions to foods, you're sensitive to foods, then you probably need some butyrate as well. It will seal that gut lining. It will help improve inflammation. And that alone is going to help you lose weight. So these are kind of just basic principles. A couple other things I would do is eat according to your dosha. And there are plenty of free books that you can get, and I'll link to one of them in the show notes here, but that talk about how to eat according to your dosha. And it is a very helpful Ayurvedic tradition. If you're a person who has, the kapha dosha, you're a little bit more on the heftier side, there's certain foods you really don't benefit from eating. You eat them and you're going to gain more weight. And same if you're in the pitta dosha or the vata dosha. These are doshas that they explain your type of metabolic constitution, even your personality constitutions and things like that. So pay attention to maybe looking into some dosha dieting. And the other thing is supplementations, that certain supplements that will help include berberine. Berberine is very popular. It's become really popular. We have several on our website that I recommend that are really well balanced. Berberine on its own may not be the best thing to do. So you really do need to look at a well balanced berberine. And like I said, the ones on our site are ones that I would approve for that. So berberine is an amazing herb that will work to stabilize glucose and improve your weight loss. It really, another one that will help butyrate production in your gut, heal the gut, seal the gut. But the main thing is that it really does a tremendous amount of work on glucose stabilization. So that helps with your weight loss. And you can get butyrate. We talked about that a minute ago. I'm bringing it back up here for a second because we talked about butyrate, but butyrate is actually it's a short chain fatty acid that you can actually get in foods. So things like green bananas and plantains, those are high in butyrate levels. So I encourage you, if you can handle a green banana, to eat it. Eat half a green banana each day. There are other foods that are high in butyrate levels that if you incorporate those into your diet, it's going to help heal and seal your gut and reduce inflammation. So those types of things are awesome choices. Other herbs that I've used include jambola, and sorry, I'm going by memory here. There's quite a few that I use in this category, but jambola would be another one. So there are many options. So my point I'm making here is that Ozempic is not the end all be all. There is a strategy that can be used. You can lose weight naturally without using Ozempic if you do it the right way. Give your body what it needs. Give your body what it needs to do its job. It has an innate intelligence, and it will do what it was designed to do naturally. You can be your own best doctor, guys. Okay, that's it. That's all I have on Ozempic. That's enough for one day. I hope that this was information that blesses you and that you can take away and make a lot of changes in your life, in your mindset. I hope that you walk away feeling more powerful and able to do this thing. You can do it. I know you can. All right, guys. Till next time. Talk to you soon.